Here is the uncomfortable truth. You can eat perfectly, work out at the perfect times, even nail hydration and electrolytes. But if your sleep is broken, your metabolism never truly heals. Sleep isn't passive downtime. It's the most powerful metabolic therapy your body has. In fact, nothing, no drug, no supplement comes close. Every night, your body runs a repair program that no pill can replicate. Deep sleep recalibrates your metabolism. Hormones reset, cells repair, and the inflammation cools down. If you miss this window, it's like skipping the software update your operational system needs. And your biology gets buggy, slow, and unstable. Think of sleep as the operating system of your metabolism. Every aspect, glucose regulation, fat burning, mitochondrial repair, runs on it. During slow wave sleep, growth hormone surges, driving muscle recovery and tissue repair. During REM sleep, your brain's emotional circuits reset, cortisol normalizes, and your stress-driven eating drops. And here is the kicker. After just one night of 4 to 5 hours of sleep, healthy people can become temporarily insulin resistant. That's equivalent of pushing them towards pre-diabetes in 24 hours. That's how metabolically fragile we are without sleep. Your circadian rhythm is the conductor of the orchestra. Cortisol should drop at night, melatonin should rise, and growth hormone should peak in pulses. But if you are scrolling at night, eating late, or bathing in artificial light, you desynchronize this system. And the result is higher evening glucose, impaired fat burning, and more next day cravings. This is why a poor sleeper reach for sugar and snack. That's not because of willpower. It's because of hormonal chaos. Sleep isn't just about energy. It's your anti-inflammatory switch. A prominent sleep study has shown that even just 1 week of 4-hour sleep restriction can drive C-reactive protein, commonly known as CRP, an inflammatory marker, by up to 40%. And the result? Accelerated arterial plaque buildup. That means increased blocking of blood vessels and circulation problem. More joint pain and swelling. Brain fog, poor memory and concentration. Your overall cognition is affected. If your sleep is broken, your immune system never gets to cool down. And the chronic inflammation becomes your metabolic baseline. And you know, chronic inflammation is the root cause of all illnesses. So how do we fix a broken sleep? Here is the metabolic sleep protocol I use with all my patients. The rhythm for nighttime sleep starts with a light exposure in the morning. Yes, it is vital to have sunlight exposure within 30 minutes of waking up because it sets up your circadian rhythm. And avoid blue light exposure 1 to 2 hours before sleep, that is from the screens. As far as temperature is concerned, cool down the room temperature to 18 degrees Celsius or 65 degrees Fahrenheit. Your core temperature must drop for deep sleep. You can take a warm shower in the evening. It helps to drop your core temperature. As far as meals are concerned, avoid eating 3 hours before sleep. And avoid high carbs because high carbs late in the evening spike insulin and blocks growth hormone release. As far as movement is concerned, exercise in the morning and afternoon can promote deep sleep pressure. But high intensity interval training late in the evening can disrupt this. Now coming to the nutrients, magnesium and electrolytes calms your nervous system. They enhance GABA activity and promotes deep sleep. Last but not the least, consistency. This is vital if you want to improve the sleep quality and quantity. Go to bed and wake up at the same time, weekends included. When sleep is optimized, every metabolic lever, nutrition, exercise, hydration works better. Mitochondria regenerate, hormones synchronize, your brain clears amyloid plaques through lymphatic system, protecting you against dementia. That's why sleep isn't just rest, it's precision medicine for your metabolism, your brain, and your longevity. And as Dr. Matthew Walker says, sleep is the most effective thing we can do to reset our brain and body health each day. So remember this, sleep is not the reward for a productive day. It's the foundation that makes tomorrow's productivity, energy, and health possible. Sleep is the master regulator of metabolism. Treat it like medicine. But here is the catch. Even the perfect sleep gets destroyed if your stress hormones are constantly elevated. That's why next week we are tackling stress, the silent saboteur of metabolism. I'll show you how to rewire your nervous system so that every other intervention, food, exercise, sleep, actually work. Don't miss this. This might change your health forever. If today's episode helped you reframe sleep as metabolic reset button, share it with someone who is burning their health by burning the midnight oil. I'll see you next week.